Welcome back to News This Week in Nursing Homes. Happy Valentine's Day, Qers. I'm Nurse Bug. First up, LTCs and SNFs. CMS offers support to participate and succeed in quality payment programs. They include short videos to help understand what QPP is, advanced payment models, final rule, and multiple contacts for CMS QPP questions and concerns at cms.gov. Next up, texting of patient info and orders. Among healthcare team members, this is permissible if HIPAA-compliant, secure text platform and compliant with the conditions of participation. Find more info at cms.gov. LTC facilities say that care deserts are growing in rural areas. A Nebraska nursing home facility official warns of a growing crisis in rural areas. 29 facilities closed in the past 3 years, leaving 20 counties what's called care deserts, or having to travel at least 2 hours or more to access any type of medical or nursing home care. In part, the current gap between cost of care and what Medicaid pays is $49 per day. Bill LB 942 would increase reimbursement rates for nursing homes. Measures could cost around $14 million annually, bringing in an additional $17 million in federal funds. Bill LB 1087 would provide billions in hospital funding, which helps LTC facilities as well. Residents shouldn't have to worry about having accessible health care, and to do that, LTC deserts must be stopped. Bills were presented on Tuesday, February 13th. A South Dakota campaign joins state and federal efforts to expand rural telehealth access. The pandemic helped demonstrate the importance of telehealth access to older adults, and states with pandemic-era relief funds are planning to ensure telehealth access is a permanent feature of the senior living and care environment. Continued need for telehealth options is important for nursing home residents, especially those living in rural areas. Legislation granting $5 million to nursing homes to implement telehealth medicine technology, known as Bill 209, was filed in the Senate last week. The Future of Rural Healthcare Summit was held the past 2 years in South Dakota, and major telehealth providers such as Avera are based in that region. The telehealth expansion bill, reintroduced last month, would remove restrictions for Medicare recipients to allow telehealth appointments. At the summit last fall, healthcare experts expressed optimism about legislation and initiatives underway to provide necessary levels of telehealth access and wireless capability to rural areas. Find more at McKnightSeniorLiving.com. Next up, just a reminder that on 2/23/24, Qsource CSC live webinar will be at 11 a.m. CST, 12 p.m. EST. Are you ready for the new SNFs VBP? By 2028, CMS will implement 8 measures facilities need to perform well on to retain some or all of the 2% withholding for the SNF VBP. Learn the measures include scoring methods and health equity adjustments as well. Join Joel Van Eaton to get up to speed. Register at the link below. About 30% of older adults needing care for another. The Journal of American Geriatric Society found 32% of older adult caregivers are also receiving care for ADLs. Caregivers are more likely to care for younger spouses, have limited financial assets, and failing physical health. Programs to support community caregivers should address unique challenges in managing their own care needs. For more information on this, visit mcknights.com. And last but not least, Valentine's Day robo-pets for the lonely. Love comes in many forms, and this Valentine's Day, one New York senior living provider is giving out robot pet companions to seniors. 40 robot pets have been distributed so far, most recently to a 90-year-old woman gifted a robotic golden retriever. Losing a pet is particularly hard, as pets can often be a main source of routine, motivation, and purpose. If robotic companions become widely accepted, new opportunities to address feelings of isolation open up. Studies revealed a connection between loneliness and overall health. Robo-Pet program is designed to help members cope with loneliness and isolation without challenges of caring for living pets. The therapeutic effect nurtures and heals, and robotic dogs bark, stretch, change positions after touched or petted, and they're no substitute for a real dog. but it does make them smile. Thank you for joining me for News This Week in Nursing Homes. To get more of the Q news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.